My name is Muchaleta Monzora, and I'm the Crown Agent Zimbabwe Managing Director. Zimbabwe is just one of the 60 countries that Crown Agents works in to tackle some of the toughest challenges that governments and institutions must solve in order to improve the quality of life for their citizens. Since 2014, we've been working in collaboration with the Ministry of Health and Child Care, UNICEF, and donors of the Health Development Fund to make health services accessible to the most vulnerable across the country, mothers and babies. We do this by ensuring that health facilities adhere to the government policy of removal of user fees at primary health care level. This ensures that even the poorest have access to medical care. The program is called the Resourcebased Financing in Health Program, and it rewards health facilities with funding for performance. This improves local ownership. The program is active in 42 rural districts in 8 provinces of Zimbabwe, whilst the rest of the 18 districts are funded by the government of Zimbabwe and the World Bank. We are proud to report that over the last 5 years, the program has reached an estimated 6.6 million people. This is over a third of the Zimbabwean population. The initiative is extremely important for rural communities since many people living there do not have access to essential health care during and after their pregnancies, and in many cases, this endangers their lives and those of their newborns. Covid-19, however, has rightly put the focus of the entire global health community onto preventing infection. For Zimbabwe, stakeholders quickly realized that through programs like our Resource-Based Financing in Health program, local communities and health facilities were able to instantly put measures into place to enable social distancing and purchase some simple essential personal protective equipment supplies, simple items like buckets, soap, and water to wash hands. These simple measures make a big difference in slowing down the pandemic. Hence, it was quickly decided to allow the RBF program continue, and in fact, to build COVID-19 infection prevention activities into the program. The solution, I think, lies very much in strengthening national and local systems long term so that they can deal with emergencies such as this whilst ensuring that essential services continue. Our approach in the Resource-Based Financing in Health program has been to work with and through existing health structures and policies of Zimbabwe's Ministry of Health and Child Care. It has been crucial for us to ensure the longevity of the program, and we can only do so by integrating our program approach into existing systems to strengthen health service delivery long term. We have been making great progress so far, but the pandemic is jeopardizing those achievements by diverting already scarce resources. We are now presented with the challenge, but also the opportunity to look at health delivery more holistically. Whilst we need to carry on fighting the pandemic, we must also guarantee existing services are still being delivered to not only save lives, but also to ensure that existing achievements do not evaporate. We must continue to support the most vulnerable and leave no one behind. Here in Zimbabwe, we will aim to ensure that we continue our work on maternal and child care as best that we can, despite these unprecedented challenges. I would like to take this opportunity to thank UNICEF, donors of the Health Development Fund, and the Ministry of Health and Child Care for their support thus far, and remain hopeful that maternal and child's health remains a priority for the international community today and in the years to come.